Nick the Nurse here. Today we're going to be talking about the risk factors and causes of the nursing problem hypercalcemia. Now with hypercalcemia, there are a slew of different risk factors and causes that you need to be familiar with to do well on your nursing school exams or on the NCLEX. Risk factors can include hyperparathyroidism. Recall with hyperparathyroidism, you have an increased calcium level and a decreased phosphorus level. Increased calcium, decreased phosphorus. So make sure that you're familiar with that. Prolonged immobility can certainly lead to hypercalcemia. That's something that is frequently tested on nursing school exams. It's not really something that a lot of students think about. I would encourage you to be very, very, very familiar with that. So prolonged immobility certainly comes up a lot. Osteoporosis certainly can come up as well as a risk factor. Hypophosphatemia can certainly cause or be associated with hypercalcemia. And remember, that goes back when you think about hyperparathyroidism, you have increased calcium and decreased phosphorus. Those two often go hand in hand. And when you think phosphorus and calcium, the thing that comes to my mind, and probably should come to your mind as well, are human bones. Bones have a lot to do with calcium and phosphorus, or actually phosphorus and calcium have a lot to do with bones. So you need to automatically make that connection and it'll be easier for you to remember. Lithium use, right? Prolonged use of calcium-containing IV fluids can certainly lead to hypercalcemia. Thiazide diuretics and tumors. All of these things can be risk factors or causes for hypercalcemia that you should be familiar with. The ones that I would focus on, if I were you and you have a sadistic nursing instructor, would be the hyperparathyroidism, bar none. You have to know that. Increased calcium, decreased phosphorus. You also need to think about prolonged immobility. That's one that they might kind of sneak in on you. When you think hypercalcemia, think prolonged immobility. Patient lopped up in a hospital bed, or somebody, somebody who's getting home care. Nobody turns them or moves them. These patients are at risk for hypercalcemia, so keep that in mind. Osteoporosis, also a big one. So there's a lot there, but I gave you some of the ones that you should probably pay a little bit more attention to. They are more testable and might even come up in your practice as well. Who knows? And they certainly are game on the NCLEX, so make sure you that you know them. Again, my name's Nick the Nurse. I'd like to thank you for watching my video today. If you'd like to check out any of my other free videos, they're all at www.nickthenurse.com. Again, that's www.nickthenurse.com. Or you can subscribe to my YouTube channel, Nick the Nurse. Thanks for watching, and I'll see you next time.